Greetings. I'm Nancy Lever, and I'm a clinical psychologist and an associate professor at the University of Maryland School of Medicine. I co-direct the National Center for School Mental Health, which focuses on advancing school mental health policies and programs at the school, district, state, and national level.
Hello, and I'm Derek Simmons. I was formerly the Director of Student Services for Caroline County Public Schools and recently named the Interim Superintendent for Caroline County.
Within the WISC model, counseling, psychological, and social services refer to prevention and intervention services to support student mental health. Services include a broad array of assessments, referrals to school-based and community supports and services, and counseling and consultation. Mental health identification and referral are critical components. School staff and teachers in particular are often the first adults to recognize mental health concerns in students. Offering professional development for teachers and school staff on mental health identification and referral, and also having mental health screening and assessment processes available can help to ensure that students with mental health needs are identified and given the supports that they need. Providing mental health services in schools should build on the foundation of student instructional support personnel, such as school social workers, school psychologists, to include community partners in order to provide a fuller array of services and supports. In the words of our colleagues at the National Association of School Psychologists, when it comes to school employed and community partners supporting school mental health, it is not either or, it is both and. When partnering around mental health services in schools, it's important for families, youth, and school staff to be aware of available services and supports, and for there to be clear policy and procedures on how to make a referral and how to have a coordinated system of care. Let's now hear from Dr. Simmons about his superintendent perspective.
Thank you, Nancy. Each school system and district is unique, as is its community. Each of us has a different set of tools and resources that are readily available to us, both internally and externally. And it's important that each school harness those resources from within and also build those community partnerships in order to strengthen their access for services for their students. Additionally, these partnerships, when put together well, also help to increase staff understanding and staff professional development related to mental health concerns to strengthen support for students within the building.
Students and staff mental health have been greatly impacted during the pandemic, particularly related to increased rates of depression and anxiety. With more students likely to need mental health services and supports, increasing mental health awareness efforts and strengthening school district capacity to provide Tier 1 and Tier 2 services will be essential. Telehealth and use of virtual platforms have been essential for providing care during the pandemic, and lessons have been learned about how to better use technology to improve communication and collaboration with youth and families. As we wrap up the school year and move into the next, we need to figure out how to use what we have learned to build back even better systems. Let's now turn to Dr. Simmons, who will share practical examples from his district.
Thank you again, Nancy. The pandemic has opened our eyes really to examining this opportunity from a different lens than one we saw before. The bringing of devices into student hands as we move to a one-to-one district has really opened up the opportunity to access those mental health services that we did not have access to previously. As we return and bring students back to the building, it's important that school systems harness this opportunity with in-person providers, as well as those who are available to reach out to our students through community MOUs and partnerships to provide those services. Additionally, it's equally as important that we create that school environment as students come in, again, working through our partners, that eliminates the stigma associated with those seeking mental health support and building that positive system that we hope to be in place that supports all of our students in their needs for accessing any of their health services.
Thank you, Dr. Simmons, and to our participants, thank you for listening, and we hope that you find these counseling, psychological, and social service recommendations helpful in prioritizing mental health in your schools.